difference between true and false labor. This is so important during OB, and hint hint, I definitely saw this on the NCLEX. These mnemonics will tell you the most important info you need to know. For true labor, use the word true, and for false labor, use the word fake. Instead of going through each separately, I'm going to start with true labor and show you the difference in false. T is for timing of contractions that increase in frequency, duration, and intensity. Keyword here is increase. In false labor, we have erratic timing of contractions. They don't increase and can be called Braxton-Hicks contractions. R is for radiating discomfort that radiates from the lower back and wraps around to the abdomen. Keyword here is radiate. Baby is also making their descent, so pressure will start at the top of the uterus and move downward. In false, we see discomfort in the lower abdomen and groin that stays in place. U is for unable to relieve contractions with activity. In false, activity helps contractions decrease. E is for exam changes. True labor has increased cervical changes, and false will have no cervical changes. Always remember the 5-1-1 rule. If contractions happen every 5 minutes, lasting 1 minute for 1 or more hours, go to the hospital. Baby's coming if we see presence of amniotic fluid or bloody show.